welcome everyone to our first enlightening episode of the podcast series by Rotaract Club of Delhi Pegasus, where we bring to you insightful conversations on health and wellness topics that matter. I am David, your host, and today we are diving into a crucial subject that affects millions of women worldwide: cervical cancer. Joining us today is a distinguished medical professional or true pillar of the community whose dedication and compassionate care knows no bounds. Dr. Yatish Sharma. Off to you, doctor. So, can you please introduce yourself to the thousands of people who will be watching this?
Hello, Devik. And hello to everybody who's watching us today. My name is Dr. Yatish Sharma. I am a practicing general physician. I have my clinic in Vasant Vihar in New Delhi, and we strive to provide good quality primary care to all my patients. So we have a team of, I am the GP, the general physician, or a family doctor. And we have in our team clinical psychologists, physiotherapists, nutritionists, and the paramedical staff like nurses who are required to provide good quality primary care to our friendly neighbors. So welcome again, everyone. Today's topic is cervical cancer, which is a leading cause of illness in women all over the world. So let's start. So David, we can start.
Yes, so sounds like you have a wonderful team for your patients. So could you provide your audience, our audience, with an overview of what cervical cancer is and why is it essential for women to be informed about it?
Yes, so that sounds like the most basic and most important question. So we'll break it into two parts. What you have asked, what is cervical cancer is the first. And second is, how does it help to inform women about it, right?
Yeah.
And the first question, I will break up that question also into two parts. You have asked, what is cervical cancer? So we'll break up into two parts, cervical and cancer. So cancer is uncontrolled growth of cells. So all the cells in our body are always dividing and growing, but the growth is under control. If it goes out of control, that is called cancer. Uncontrolled growth of cells.
Okay,
all right. And cervical cancer is obviously, as the term depicts, cancer of the cervix. Now we need to know what is cervix. So cervix is the lower part of the birth canal. Birth canal is present in women. It is also known as the uterus. And the lower part of the uterus, which connects to the vagina inside the body of the lady, is called cervix. And if there is uncontrolled growth of cells of that cervix, it's called cervical cancer. All right. And the second part which you asked is, how does it help to make women aware of this? So let me tell you. To treat any disease at the global level, at the population level, those diseases which are widely prevalent in the world, in those diseases, the treatment is not just one doctor to one patient treatment, but it's a part of a global effort to reduce the disease burden in the big populations. All right. And you will be surprised to know, we all talk about the latest advances in medical field, and the latest technology, latest advances, new discovery, this, that, the other. Of course, that is very important to help us treat. But the most basic and crucial part of treatment of those diseases which are widely prevalent all over the world is awareness. That is the first step and the most important one.
right.
Awareness is and that's what we are doing right now. Actually, this is the most important part. Rather than actually going and treating somebody with cancer, that is, of course, important for that particular individual. But for the whole population, this is the most important thing which we are doing, is to spread awareness about that particular disease So, and awareness means what causes this disease, how it can be controlled, what is the best method to deal with it, that kind of a thing. So, awareness
Okay.
is the most important.
Yes, of course. If people don't know about it, then how will they actually get it cured or diagnosed? That is true. So, this is great. So now, can you explain what are the various reasons why someone might uh, become a victim of cervical cancer? You know, the role of the HPV virus, which is common. If you can dive into that, or some other reasons that because of which someone might become a victim to the disease, that would be great.
So, so this is also an important thing which we need to understand.
Okay.
Cancer, when I talked about cancer, I was saying that it is uncontrolled growth of cells, right?
Mm.
That's all that I said. I mean, how does it happen? We don't know. But in this is one cancer which is kind of unique in its own right, because it is caused by an infection. So these are two different fields in medical science. All right.
Okay.
Cancer and infection. These are two different things. They work differently. Cancer is uncontrolled growth of cells, and infection is when some foreign body, infects your body. That foreign body can be bacteria, virus, or fungus.
Okay.
So the treatment of bacteria is by antibiotics, the treatment of virus is by antivirals, and the treatment of fungus is by antifungals. But these are the treatment of infections. And we are talking of cancer, which are different things. But in this particular case, they are connected because it is a virus which actually causes this cancer.
Hmm.
And the name of that virus is HPV, which is human papilloma virus. And since it is a virus which causes this, okay, maybe not directly, but indirectly. So therefore, the treatment of this cancer is also unique because, not the treatment, but prevention of this cancer is unique because if you kill that virus, you prevent this cancer. And the virus can be killed or controlled by taking a vaccine against HPV. So the unique thing is that if you control the spread of this virus by a vaccine, you can actually control the growth of this cancer in the big populations.
Okay. So how does this virus exactly cause cancer? Like you said, it's indirect. So how is that?
Indirect, because we see in our body, again, we go to the basics and fundamentals. The cells are dividing all the time and they are under control. But if you keep irritating one particular point of our body, then the growth of those cells become agitated and frustrated. Why are we being irritated? All right. And then they out of frustration and agitation and irritability, those cells start dividing faster than the others, and that is what forms the cancer. So you can understand, if you are smoking, the smoke is irritating your throat and lungs, so you get a lung cancer. Similarly, this particular virus, if it's a sexually transmitted virus, so it goes and all individuals who are sexually active will, or maybe 90% of individuals who are sexually active will, at some point in time in their life, they will get infected with this virus because it is so common.
Okay.
But the body has tremendous capacity to heal itself and fight off the infections, which everyone does. And most of the time, within a few months to 1 year, the virus will be wiped off from the body, and the individual may or may not have symptoms. And even if the symptoms are there, they may be very mild, and it will go away. The person doesn't even come to know. So it must have affected all of us. Okay, but if the infection persists and becomes chronic, that means it is not wiped off completely, then it will lead to cancer in a few years. And again, it comes to the same thing, that the virus is constantly present in that part of the body, and it is constantly irritating those cells, and that is why it has led to cancer. This is the way this cancer is caused. The name of the virus is human papilloma virus. Many strains have been identified, and there are two particularly, devastating strains, and they have been numbered number 16 and 18. They are responsible for more than 50% of the high-grade cancer, cervical cancers. So that is one. The other thing is, why do most people are able to get rid of it and some cannot? So our body has got immunity, and the immunity fights away these infections. If our immunity is lowered, then the body will not be able to fight those infections. And as we all know, the common or the important cause of lowering our immunity is a disease called immunodeficiency, which is human immunodeficiency virus, which is HIV. And sure enough, women having HIV infection are 6 times more likely to develop cervical cancer. So that's a significant jump in the number. So HIV infected women are more vulnerable, you know. So that's what it is, because the immunity is low in HIV infected women.
Okay, so the basic cause is the repetitiveness and the severeness of how the virus affects the body, and especially those who are immunocompromised.
Correct.
It will affect them.
Yes.
Okay.
And immunocompromised, the extreme example is HIV, but there are other reasons also when people can become immunocompromised. The use of steroids is one. Some people may have to take steroid for some disease which they may have, and that reduces the immunity. The other one is, of course, deficiency of vitamins and smoking and, bad lifestyle habits, which reduce our immunity.
Okay. So, regarding this disease, have you noticed any demographic which was more affected than others? For example, maybe it's based on age, gender, of course, we know, but let's say age or ethnicity. Was there any demographic trend that these people are more likely?
Africa, as if you talk about the race, then Africans. If you talk about the age, then obviously as the age grows, it is more prevalent. More than 50 or 55 years of age, women are much more affected, and that is the reason. So, as I said, the virus infects on people who are sexually active. So maybe from the age of 20, 25, it may affect. But it takes 1 or 2 decades for the chronic infection to lead to the cancer. So that makes the woman at the age of 50, 55. That's when the maximum incidence is seen. And Africa, because vaccine is not there, HIV is very, very rampant in African race. It's like really rampant. You can't believe it. And there is low immunity also. So that's why.
So HIV, someone with HIV, he'll be more susceptible to HPV and so on. That's how it goes.
Not he. She will be.
She.
Because it's, yeah.
Okay. So now, what can you tell us about the term comprehensive cervical cancer control? So what does that include?
Comprehensive care means we have to deal at all the levels. So all comprehensive cares will have 4 parts. Okay, primary prevention, secondary prevention, tertiary prevention, and palliative care. Primary prevention is we don't let the disease happen. Okay, so we try to prevent the chronic HPV infection, and that can be done by vaccine. That's the most important. If you talk about populations and global level, vaccination against HPV, this would be the single most important method to reduce the disease burden. And so that is primary prevention. You don't let the disease happen. The secondary prevention is, if we are past that, then we try to screen women and try to catch the cancer before it has actually developed into a full-blown cancer. So that is called pre-cancer.
Okay.
So that is secondary prevention is screening. Screening the women before full-blown cancer to catch it in the pre-cancerous stage, and the treatment at that stage is much simpler than the treatment of full-blown cancer. The third is tertiary care. Tertiary care is the patients who have full-blown cancer. It has to be diagnosed and treated. Those who have full-blown cancer is also known as invasive cervical cancer, they have to be diagnosed and treated. And the fourth is palliative care. That is that stage at which the cancer has spread so much that, it's kind of tough to get rid of it. So palliative care is the care of the terminal patient, uh, which includes all sorts of support systems and support groups, and taking care of the individual as a whole, not only of the cancer. So that is palliative care. So four: primary prevention is vaccination. Secondary prevention is screening and treatment of precancerous. Tertiary prevention is treatment of cancer, invasive cancer, and palliative is terminal support. Yeah.
Okay, so out of these four stages in cancer, typically what I've heard is when a person actually gets diagnosed, it's a lot of times very late.
Yeah.
So at what point in these four stages do you think that a person will be able to identify that maybe, okay, there is a chance that she has cancer and come to a doctor for diagnosis and successfully be cured also?
You know, it is not, it can't be left up to the patient to come to the doctor. It is
Okay.
the community or the government which has to go to the community and screen. So it is so big that you can't imagine. I mean, it's like really big. So therefore, there is a global strategy for it, for cervical cancer, to eliminate cervical cancer. And all countries have made a commitment, because it's a public health problem. So WHO has a global strategy to eliminate cervical cancer, and they have defined elimination also. They mean that so they are saying that elimination means reducing the number of new cases, uh, which is called also known as the incidence rate, to below 4 per 100,000 or 1 lakh women. That will be called elimination, and they have come up with a strategy to have it done. And the strategy is called 90-70-90 strategy by 2030, 2030. So the strategy means, first is, again, it's the same: vaccination, screening, and treatment. Vaccination means there is 90%. 90%. So this is the target. This is the aim. 90% of girls should be fully vaccinated with HPV by before the age of 15. That is
Okay.
vaccination. Second is screening. That is 70% of women should be screened at least twice in their life. One is at the age of 35 and one is before the age of 45. That is screening. The third is treatment. 90% of women in the pre-cancer stage should be treated, and 90% of the women who have invasive cervical cancer should be managed. So this becomes 90-70-30. 90% should be vaccinated, 70% should be screened, and 90% who have the cancer should be treated or managed. And once we achieve this 90-70-90 target by the year 2030, then we would have eliminated cancer, cervical cancer, from the world, which means that the new cases will be less than 4 per 100,000. So this is the global WHO strategy.
Okay, this sounds amazing. I mean, this can really reduce the number of cases we have for cervical cancer. So you mentioned something about screening. So can you tell us, so what are the various tests or screening methods that can help a patient to identify if she has cervical cancer or not?
So there are two tests: Pap Smear and HPV DNA.
Okay.
Pap Smear is a screening; both are screening tests. Pap Smears is so like the way we go for a complete health checkup. The complete health checkup, we are focusing on blood tests for heart and liver, kidney, all that, and chest X-ray for the lungs, and ultrasound of the abdomen for the liver and kidney and all those things. Similar, in the same meeting, a Pap smear should be done for women, about the age of 21. So, and that is done. If you go to any hospital in Delhi, Pap smear is a part of the comprehensive checkup. So that is done, let's say, once a year or once in 2 years. That should be fine. It's not a very fast growing cancer, it's a slow growing.
Mm.
So above the age of 30, uh, the pap smear has to be done. And if the lady has got HIV, then above the age of 25, it should be done. Because,
Okay.
So that is one. So that is screening. But prevention is not only screening, it is also, as we spoke, public awareness, HPV vaccine, and to practice and to reduce the chances of low immunity. And that is by a good lifestyle, that is avoid smoking. And now that we know that this is a sexually transmitted disease, so practice safe sex, and like using a condom and limiting the number of sexual partners. That is also part of the strategy for prevention of cervical cancer.
Okay. Okay. So if someone actually gets diagnosed with cervical cancer, what are the various treatment options that she has to get rid of it or to maybe reduce its impact?
So again, the treatment is at the pre-cancer level or at the cancer level. If we catch at the pre-cancer level, then the treatment is a simple procedure, simple and quick procedure, which is painless, and it does not have any complications. Uh, Pre-cancer treatment can be done in various ways. There are methods. There is a thermal ablation, means at high temperature one can remove it. There is a cryotherapy, that means you cool it so much that the cells die away because it's a small part. Then the cone biopsy, something called cone biopsy can be done, which is a traditional method of treating the precancers. So treatment of precancers can be done in a single session in the doctor's office, in the gynecologist's office. And the various methods available are at thermal ablation, cryotherapy, or cone biopsy. These are the and if it has spread a little more, then removing it surgically. That part. It can be done by electrical cautery also. So all sorts of methods are available to deal, and it's easy, simple, painless, and no complications. So these are available. Different doctors are using different methods, whatever is available, but they are effective, and they work.
Hmm.
Yeah.
And what about the post cancer treatment?
If the cancer has spread, then of course chemotherapy, targeted therapy, immunotherapy, surgery. There are different types of surgeries. One is a cone biopsy, as I said. The other one is to remove the complete cervix. And if it has spread a lot, then you have to remove the cervix and the uterus. It's called hysterectomy. In the first two, that is the cone biopsy and removing the cervix only, the patient can still can bear children, like can become pregnant. But if it has spread so much that the cervix and uterus both have to be removed, that is called hysterectomy, then the woman cannot bear children anymore. So that's too late. But of course, it has to be done to save the life of the individual.
Right. So what I realized here is that the earlier someone catches it, the better it is.
Right.
And it's not about the patient to feel or identify that she might have cervical cancer. It's more about having regular checkups at different stages of her life. So whenever she goes to a doctor for a checkup, she should get a test for cervical cancer also. And that can help that.
Wait for the woman to have symptoms. The symptoms can be there when it is too late.
Okay.
But even if that stage is there, then people should be aware of the symptoms. So the symptoms, as you can imagine, because it is in that part of the body, which is the birth canal, and that. So the symptoms are obvious. There will be foul smelling, vaginal discharge, and there will be discomfort like pain. Not only in that region, but also in the back or the legs or the pelvic region. And there will be disturbed menstrual bleeding. So either it will be too much or too little, or not at the correct time or in between the cycles. So that is disturbed menstrual bleeding associated with more pain. And as with all cancers, there will be weight loss and fatigue, tiredness. The person is not able to work or perform the way she used to do earlier. And there is loss of appetite. These are common symptoms of all cancers. When you have a cancer, you don't feel like eating. So, loss of appetite,
Okay.
and then swelling in the neck. So, these are the type of symptoms. But once you have the symptoms, it is too late. Of course, not to say that, I mean, it's too late, so I can't do anything. No, if you have these symptoms, you rush to the doctor and treat it. But the better idea would have been to treat before these symptoms came.
So having regular checkups is the primary message here. You should
Yeah.
get yourself checked up again and again for cervical cancer.
Not only get checked up, but also take the vaccine and also do the safety things which we just discussed. You know.
Okay. 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 So let's say unfortunately someone does reach a stage where this cancer is a little extreme. So can you tell us about palliative care? So palliative care.
Palliative care,
Palliative care. Yeah.
palliative care means it's a special type of health care. When although you have the disease, but the care will help you feel better. Now we can't treat the disease; it's too late. But we still have to, help our fellow human beings to feel better. So that is called palliative care. So it involves pain management and help the patient to eat and breathe and stuff like that. But not only that, uh, also to take care of the family members, because cancer is a disease which not only affects the individuals but also affects the rest of the family in more ways than one. There is a psychological impact, uh, there is financial impact, and there is physical impact. I mean, the one person is not well in the family. This is not a disease which will go away in one day. It will keep on for months or years. So one person is unwell and the other person has to take care of this person. So to handle that, it's called palliative care. There's a team. There are online groups. There are NGOs which comprise of doctors, nurses, paramedical staff, physiotherapists, support system, psychologist. Psychology plays a big role in cancer management. And now you will be surprised to know that therapy, like behavioral therapy and psychological therapy, counseling, helps a lot, because as we have all heard at some point in life that keeping a positive attitude will help you tide over your diseases. And this is more important, more relevant to cancers, because in cancer, you definitely need to be more positive to be able to handle it. Otherwise, you'll go into depression and all that. So the team is there of doctors, nurses, other trained paramedical staff, professionals, which provide the palliative care. And the goal is to improve the quality of life, not the quantity of life, or like to prolong life, but whatever life is there, to improve the quality of life. And so yeah, to help people with cancer feel better and live a better quality of life. That's called palliative care.
Oh, that's wonderful. So if a person does reach this stage, unfortunately, then it is important to maintain the quality of his or of her life.
Yes, yes,
Rather
yes.
than prolonging the years, it's better to focus on whatever time she has left. She should feel comfortable in that time.
That's correct.
Okay. And this cancer affects the cervix. So is there some special considerations that we should take into account when it comes to pregnant women?
Pregnant women, as I said, it's an opportunity. It is seen as an opportunity because the people don't want to go to hospital. Women
Okay.
don't. They never go to hospital. I mean,
Hmm.
nobody wants to go. But during pregnancy, uh, they have to go and interact with the doctor, the gynecologist. So that has been identified actually as a time, as an opportunity to talk to the patient about cervical cancer and encourage them to go for the HPV vaccine. So, and by the way, HPV does not only cause cancer. Cancer is the last manifestation of
Okay.
HPV. Before that, it
Hmm.
causes warts, genital warts, which are painful. And cervical cancer is not the only cancer which it causes. It causes anal cancer also. है ना?
Okay. Hmm.
So, pregnancy is seen as an opportunity globally to talk to the lady and convince her, to take up the vaccine, because the cancer is more common after the pregnancy.
Hmm. Okay.
Mm. And then the psychological aspects are there. There are genital warts and these pains. They are distressing, embarrassing, uncomfortable, and the psychological impact is there. So all this has to be told to the patient that look, if you get the cancer, then there is shock and there is fear and there is anxiety. So it's better to take the vaccine right now.
So having these warts, is this an exclusive disease or it's like a precursor to cervical cancer? So if someone has these warts, that they can also develop cancer later.
It's a
Is that
precursor
is
to cancer. It's a precursor to cancer, but if it is treated at that point of time, then it will not develop into cancer. If it is left
okay, okay.
untreated, so it takes
Hmm.
many years for the cancer to develop.
Okay, okay. This was very comprehensive. So Dr. Yatish, we are at the end of our podcast here, and it
I
was an
hope
honor
this
to have it was an honor to have you here. And we will make sure that this podcast reaches as many people as possible and we can share your insights with them. So, just to conclude, is there anything else that you would like to tell our viewers, especially those females who are more susceptible to cervical cancer?
Yeah. Yeah. So the idea is the same. We can repeat what we said. Um, that it is a very preventable and treatable form of cancer. It's very preventable because we discussed that. Treatable also we discussed that, but it is very common. 6.6 lakh new cases every year, and 3.5 lakh deaths, 350,000 deaths in 2022. And all this can be prevented by screening, by taking the vaccine and screening if you have the disease. And also to remember that it affects the lower and middle income countries, which means us, Asia and Africa, because of the reasons which we have discussed just now.
Hmm.
And the treatment, the prevention is by the vaccine for HPV. It is very expensive. It is, I mean, I will not take the brand name, although there is only one, so there's no harm in taking that brand name. But anyway, it is expensive. It's called Gardasil. Gardasil 3 is not so expensive, but the latest one is Gardasil 9, which
Hmm.
covers 9 strains of HPV. So it is more comprehensive and it is expensive. And so there is a big gap between those who should be taking it and those who can afford it. And to deal with this financial problem, governments are trying to reduce the cost. So they will start, I mean, the target is to start making it in India and reduce the cost from thousands to hundreds, so that
Okay.
more and more women can take it. And maybe in future the government may make a policy to include it in the universal immunization program so that people can get it for free. And by the way, some countries are also, I mean, like, um, some countries have made it mandatory to vaccinate boys. If we are doing it voluntarily, then yes, it should be done. But at the population level, some countries have made it mandatory to vaccinate boys also, because the HPV does not see whether it is infecting boy or girl. It
Okay.
infects both.
Hmm.
The cancer happens in women. So if boys are also vaccinated, it will be, the prevention will be better. So that's what it is.
This is a great initiative. I mean, if the government and the community as a whole can spread awareness, maybe through this podcast itself, then I think we'll be able to make a very big impact and reduce the number of cases of cervical cancer.
That's true. That's true. I hope this helps, and I hope you are able to, get a lot of people to watch it and benefit from it. Thank you, Devik. Thanks for having me
Yes,
here.
thank you. Thank you, Dr. Yatish, for your time. It was great having you here, and we hope to connect soon later also.
Of course. Have a good day. Bye.
Yes, thank you.
Ciao.